A 30-year-old man present with abdominal distension. Laparoscopy performed, and at operation, the abdomen is filled with large amount of gelatinous fluid. What is the most likely underlying diagnosis? So here very obvious that the only one point, which is the gelatinous fluid present in the abdomen, as the operation in the abdomen. So during the operation of the abdomen, when there is the huge amount or large amount of gelatinous substances, so what may be the answer? Here the options are the infection with Enteromoebia vermicularis, Enteromoebia histolytica, pseudomyxoma peritonei, metastatic colonic cancer, chylous ascites, and none of the above. So what may be the answer? First of all, let's say the pseudomyxoma peritonei. It is a rare mucinous type of tumor of the abdomen. So it is a very rare tumor, and it is the mucinous type of the tumor, and most commonly it arises from the appendix. So appendix is the most common site for a mucinous tumor. This mucinous tumor also arises from the any other part of the intestine, but the most common site is the appendix. And what is the incidence? The incidence is 1 or 2 in 10 lakh per year, which is very smaller amount. An accumulation of large amount of mucinous material, the mucinous material, that means the gelatinous material in the abdominal cavity. So when there is a large amount of gelatinous material in the abdominal cavity, it is the pseudomyxoma peritonei. And the pseudomyxoma peritonei, what is the treatment option? The treatment option is peritoneumectomy, which is a big operation, huge operation, also known as the sugar baker procedure, in which the different part of the omentum usually are resected. And a heated intraperitoneal chemotherapy also given. It is another procedure in which what happens, the abdominal cavity temperature is increased artificially and given chemotherapy, and when there is intra-abdominal temperature is more increases, then chemotherapy more activated and chemotherapy acts more accurately. So the temperature procedure, chemotherapy also be given after peritoneumectomy in case of the sugar baker procedure, and it is the latest technique in case of different type of the cancer treatment and it is invented by this sugar baker. The pseudomyxoma is associated with a deposit of large amount of gelatinous material. So this mucinous substance is known as the gelatinous material, and appendix is the most common site of the origin. So appendix is the most common site of origin of this type of the tumor. Here we can see this is the pseudomyxoma peritonei, and this is the jelly-like substances present. So when there is gelatinous substances, what is the diagnosis? The diagnosis is the pseudomyxoma peritonei. Thank you all.